My name is Dr. Barry Goodell. I'm a professor at the University of Wisconsin School of Pharmacy. And it is really my great pleasure today to introduce Dr. Paige Pinnell, who is the Henry Higman Professor of Neurology and the Chair of the Department of Neurology at University of Pittsburgh. Paige, thanks for joining us today.
Thank you for having me.
We have an important topic that I want to talk to you about today. You know, it's been about almost about 10 years or so since the NEED study was published, and that really started to introduce us to, some really a different way of looking or important way of looking at these anti-seizure medicines. So tell me where we've done here. We now have a new paper, the MONEED paper. Tell me what this has added to the literature.
Yeah, so we're really excited at the conclusion of MONEED. So we've really finished all the data gathering and analysis. So our latest publication was based upon the neurodevelopmental outcomes of the children enrolled in MONEED at the age of 3 years old. So this study was different. It was expanded. We had control groups, which we didn't have in NEED, and we took women who were on any medication. So there wasn't a selection a priori about which medication they're on. So it reflects clinical practice. We looked at several outcomes, but the latest finding is looking how the children did after exposure to certain medications in utero. And the great news is that they didn't differ from the control group, which was healthy pregnant women that were enrolled. So their children did the same as 3-year-olds of healthy pregnant women on no medications when we looked at their neurodevelopmental outcomes. So we were thrilled with that finding. Of course, it does represent current prescription practices, which were many of the women were on lamotrigine or levetiracetam monotherapy. Some of them many were on a combination of those two medications. And then we had a smattering of other medications.
So let me ask you then, you took patients, they could be on whatever. So were there still a lot of the older, can you give me a little bit more of a breakdown? Were there a lot of the older generation, any seizure medications? And you mentioned lamotrigine and levetiracetam. Besides just that, if you give a little more specifics, tell me, because I think you also looked at plasma concentrations and dose effects, right?
Right.
Is there anything there? We've always been concerned about, giving too much drug.
Yeah, no, great question. So again, with MONEED, we were able to really expand the design of the study in several ways. And that was a key difference, is we obtained concentrations throughout pregnancy of the anti-seizure medications. And then we use that to, of course, look at many of our outcomes, including seizures. But for the neurodevelopmental outcomes, that is sort of the nuance to the message. Yeah. So the nuance to this message is that when we did secondary analysis, we did see some detrimental effects of higher concentrations of medications in the 3rd trimester. So when we really looked into the details, levetiracetam really stood out. So again, levetiracetam is a great medication. Children born to women on levetiracetam did great, and no different controls. I don't want to take away from that message. However, if the serum concentrations in the mother were particularly high, so I'm, kind of in the range of 35 to 45 or higher micrograms per milliliter, then we started to see some detrimental effects on the child's neurodevelopmental outcomes, such as their verbal learning abilities. And we have other papers coming out in press or being submitted that support that finding continuing as the children are tested at later ages. So we do think it's a true finding.
Tell me what we do with this information now. And I'm going to now to counsel, young woman who was thinking about getting pregnant, or maybe, someone who is already pregnant. What's the takeaway? What do we tell them?
Well, it kind of comes back to really that overall message is really trying to figure out what that woman's target concentration is. What does she need to control her seizures, or at least her convulsions, and not just being randomly increasing the dose and getting way above what she needs for her seizure control. So trying to maintain that target concentration, which should ideally be established prior to pregnancy, but if it's not, certainly trying to figure it out by historically in the records and obtaining a concentration early in pregnancy.
Okay. So the bottom line takeaway message from this amazing study is don't be afraid to treating the seizures. And these drugs, with the exception of valproate, obviously, these drugs are, can be safe and effective. Don't be afraid to treat.
Yeah, so I have to highlight one point that so the earlier study we published in New England Journal of Medicine showed that we were able to maintain very good maternal seizure control, again, similar to our non-pregnant women with epilepsy. However, that was in the setting that they were managed with medication dosage adjustments throughout pregnancy to maintain that individual target concentration. So we do continue to think that's an important principle.
Okay. So pharmacokinetics matters, right, Paige?
Yes, it definitely does.
So there's a practice guideline that's in development currently that's going to be discussing major malformations and management issues and some of these concerns. Can you give me a little bit of a hint of when what that's going to entail?
Yeah, so it's in its final stages and will be coming out. It's in development. One thing that was really nice about this guideline update was that it was done in conjunction with American Epilepsy Society, American Academy of Neurology, and Society for Maternal-Fetal Medicine. And so we had representation from OB. We also had patient representation on the panel. So we're really excited that this will be coming out, and it'll provide a lot more detail from studies, obviously many across the world, for neurodevelopmental outcomes, and especially also for major malformations, which isn't something that we looked at all in MONED because we're much smaller sample size.
Great. Well, when that does come out, we'll have to have you back and explain further.
Yeah, and with Dr. Allison Pack, who's the lead author on the whole project and on the paper.
Wonderful. So, Paige, thank you for that that summary with that preview of the upcoming guideline. Is your team working on any other projects to sort of move this work forward?
Yeah, I'm really excited about what we're trying to do next. One of my concerns is MONED, we had these great outcomes, but they were at epilepsy centers. And they were being treated by epileptologists who had an interest in this area. And our findings were so much more positive than other studies that have looked at healthcare databases or the general population. So a few of us got together and worked under the umbrella of the Epilepsy Pregnancy Medical Consortium. And I'm so excited that we've been able to put out tools on the website for clinicians and for persons living with epilepsy to really help get this information out there.
Wonderful. Well, Dr. Pennell, thank you again for this great conversation today and telling us about not only the current state of the data, but how we're moving forward in these important issues. Look forward to having you back when the guidelines are published.
Yeah. Thank you for having me. Thank you, Barry.
Absolutely.